Welcome to the Kevin Bass Show long form podcast. If you have an idea that you take from this podcast that you want to apply to your own life, you should always talk to your doctor before doing so and never construe anything you hear as medical advice. And with that, enjoy the Kevin Bass Show.
Hindsight is 20/20, right? We're looking at it from after it's over. And so many people, they just bought the narrative that was being promoted by CNN and MSNBC and wherever, that if you get vaccinated, you can't get COVID, you can't spread COVID. That was the narrative.
And that's my thing. Listen, I get it. Like, you want to test everybody every day? Cool. Yeah. That's fine. You don't want to keep people safe if that's the benchmark for it. But as we look back now, let's not revise history. Let's not revise history on what actually happened and what was said. Because what was said was, you get the vax, you can't spread it or contract it.
And no one seems upset that that was a lie, including Birx, who has said that she had always known that it was not going to stop transmission and it was not going to stop people from spreading it, which is wild. That she would say, we knew that you were still going to get it, even if you got vaccinated. Which is, no one said that.
No. Pandemic of the unvaccinated.
Yeah.
What do they call the winter? The winter of death or whatever for the non-vaxxed?
I saved that. Winter of death and suffering.
Yeah.
It's like they were Game of Thrones. Like they were talking about the fucking White Walkers coming. Winter of death. I mean, Jesus Christ. It's so wild because at that point when they had said that, we had already realized, like, oh, this is 78% of the people hospitalized were obese. Most of the people that died were either obese or very overweight or very old.
Comorbidities.
Yeah, 4 comorbidities, at least 4 for like more than 50% of the people.
Hi, in this video, I'm going to be discussing a very widespread belief that obesity was a main driver, or maybe the main driver, of the COVID pandemic. Not vaccination status, but obesity. This view is wrong. Just a disclaimer, I don't say that it's wrong because I'm some sort of left-leaning, public health zealot. I'm not at all whatsoever. I'm probably going to vote Republican in the next election. And I do think that there are some caveats with respect to the COVID vaccine for some groups of people, and automatically I'm going to lose like half my audience with that. But I just want to make sure to point out that I'm nonpartisan. I'm not interested in partisan politics, and I'm not interested in ideologies. I'm interested in debunking false belief systems and false beliefs because I think those cloud our judgment about how to set proper policy. And I don't think we can really afford to set policy based on misinformation and lies. And I hate the term misinformation because it's so abused. But maybe we can just call it like lies. It's a lie. It's a lie that obesity drove the COVID pandemic. It's a lie that it's more important than being vaccinated or not vaccinated. It simply is a lie. And in this video, which I'm just going to be using a thread from last year to create, I'm going to comment on this thread and reread it for you guys and discuss it. Where I systematically discuss the evidence in a way that has never been done anywhere else. I'm going to be demonstrating this point of view. It's not a point of view, it is the truth. So I'm going to be demonstrating the truth about this subject in this video. Let's begin. The COVID-obesity association is massively overstated, and it's been weaponized by a wide range of political and ideological and even financial interests by the Great Barrington Declaration signees, antivaxxers, and politicians, usually right-wing politicians, this is the truth, to discourage vaccination and public health measures against COVID. And this has not been good. How did we get here? And what do the data really say? And this is a thread on the topic. Okay? First, it's important to emphasize the magnitude of the problem. Amplification of the false COVID obesity narrative occurred through some of the biggest individual media influencers, including Marjorie Taylor Greene, Donald Trump Jr., and Glenn Greenwald. Let's look at these. one by one. Let's start with Marjorie Taylor Greene. She writes on Twitter, obesity, when do we help people overcome the highest risk factor for being hospitalized and dying from COVID? Obesity contributes to many unnecessary health conditions and debilitating costs, and we can listen to kids' vax warnings from a hospital bed. Okay, first off, before I go on, I want to emphasize that obesity is a really important public health problem, critically important in Western societies. But it's not the highest risk factor for being hospitalized and dying from COVID by any stretch of the imagination whatsoever. It's simply not. It's even a relatively small risk factor, as I'll be showing. If we're really trying to save lives, Donald Trump Jr. says on Twitter, why don't we mandate proper diets and exercise? Again, the implication is mandating vaccines is not right, but we should mandate proper diets and exercise. We would save a lot of lives if we mandated proper diets and exercise. We would. But it's not necessarily going to save a lot of people from COVID. What will is vaccines. And again, we're going to be showing this very clearly. Glenn Greenwald writes, CDC study finds that about 78% of people hospitalized for COVID were overweight or obese. The World Health Organization, obesity has reached epidemic proportions globally with at least 2.8 million people dying each year as a result of being overweight or obese. And again, it's true that a lot of people die from being overweight or obese, but this 78% statistic about being hospitalized for COVID were overweight or obese is incredibly misleading. And now we will show that very shortly. But first, again, we're going to keep talking about people who have amplified this message. We're going to look at Bill Maher now.
I think a lot of people died because of Trump's incompetence. And I think a lot of people died because talking about obesity had become a third rail in America. I know you've heard me pound this fried drumstick before. But since I last mentioned it, a stunning statistic was reported. 78% of those hospitalized, ventilated, or dead from COVID have been overweight. It is the key piece of the puzzle, by far the most pertinent factor, but you dare not speak its name. Imagine how many lives could have been saved if there had been some national campaign a la Michelle Obama's Let's Move program, with the urgency of the pandemic behind it. If the media and the doctors had made a point to keep saying, but there's something you can do, but we'll never know because they never did. Because the last thing you want to do is say something insensitive. We would literally rather die. Instead, we were told to lock down. Unfortunately, the killer was already in the house, and her name is Little Debbie. I think a lot of people die.
And everybody knows the controversy around Joe Rogan. This is even more pertinent to last year when there was a lot of COVID controversy about Joe Rogan in particular. And as I wrote in this thread, please listen to me here, Joe, or I'm going to keep jumping into your DMs until both of us want to kill ourselves. I'll probably send this to Joe again, this video again. And again, I recommend that everybody who likes this video, who watches it, send it to Joe. And I write, many COVID obesity narratives create a false dichotomy between vaccination and obesity, suggesting that what we really need to fight for is we need to fight against obesity. We don't need to vaccinate, but we need to fight against obesity. That's the main problem. This is a false dichotomy. And this is what both Marjorie Taylor Greene and Donald Trump Jr. have suggested, as you've seen just a moment ago. This dichotomy is a lie. And I'll show this now. Let us briefly review what the actual connection between COVID-19 and obesity really is by looking at three graphs in order. First, let us look at the risk of death from obesity versus other risk factors such as being black, being male, and having many medical conditions. So we can see in the red, the increased risk of obesity for death from COVID, and class 1 obesity, a BMI between 30 and 35, which is, I don't know, at being 6 feet tall, I think that's like between, 230 pounds or 220 pounds and up to maybe 260 at 6 feet. And then, of course, class 2 obesity is a little bit more. Class 2 obesity, morbid obesity above BMI of 40, so severely obese, increased risk of death from obesity is only about 1.9, about 2. Let's look at male sex. Male sex is 1.6-fold increase in risk. Being black is 1.5. Both of those are higher than class 2 obesity, up to a BMI of 40. And a recent cancer, also much higher. Being an organ transplant patient, way higher than even morbid obesity. Having 2 to 5 medical conditions, again, way higher than morbid obesity. 3.6 to 10 medical conditions, again, 3.3, very high. And then having more than 10 medical conditions, 3.8. Okay. As you can see, mild obesity confers only a very modest, almost undetectable increased risk of death. So PMI between 30 and 35. That's more than just being overweight, by the way. Overweight is a BMI between 25 and 30. Obesity is like legitimate obesity, 30 to 35 BMI, very, very fat for most people, except for, champion bodybuilders. But most people who are obese, 99.9% of those people are very, very fat. And severe obesity gives a risk comparable to being male or black. So being severely obese is a risk comparable to being male or black. Simply being male is about as bad as having severe obesity. So does that really mean that obesity is driving the pandemic? Maybe maleness is driving the pandemic. Maybe being black is driving the pandemic. Maybe having a recent cancer is driving the pandemic. Anything short of severe obesity is almost undetectable in terms of its additional risk. Is that driving the pandemic? Yes, the risk of death in those with mild obesity is similar, actually, to those with a BMI of 18 to 22. So if you have BMI of 18 to 22, which is like you're quite thin, you have an increased risk of dying from COVID comparable to mild obesity. And people who are overweight, in fact, have the lowest risk of dying from COVID. And this is from a figure from The Lancet. This is because being even overweight is associated with better, not worse outcomes from COVID. So interestingly, you want to be a little bit overweight, have a little bit chub, and then you actually at a better risk of dying from COVID. You're not at much of a risk. Importantly, even severe obesity is outshined by simply having 2 to 5 medical conditions or being an organ transplant recipient. So much for obesity being the main risk factor for COVID. I did not even include all the risk factors here, but it's not even close. Obesity is a modest risk factor comparable to being black or being male, and overweight might be protective. So here are the references used to generate this graph. And one of them is from the journal Nature out of Oxford. Very prestigious, each of these. And here you can see the title, if anybody wants to look this up. This paper has 2,703 citations. It's incredibly well cited. Main author Ben Goldacre, and then almost 500,000 accesses. Okay? Super, super important paper. And then the data from the multiple medical conditions is from the CDC. And you can see the link here. Here is the title and the link. Okay. Those were used to generate the graphs above. And I just want to make that clear because I really want you guys to be able to replicate this. Of course, nobody's going to look this up. But for those who really want to deep dive, you can, and you can find that what I'm saying is correct. Now, let's compare all of these to vaccination status using some of the latest data from the CDC. Looking at this, we see that obesity and vaccination are not even the same ballpark. Obesity provides paltry additional risk compared to being unvaccinated. So, again, whenever Joe says being unvaccinated isn't important, it's not a pandemic of the unvaccinated, he's just incredibly wrong. He's incredibly, gravely, terribly wrong. Even having 10 medical conditions is not anywhere near as bad as being unvaccinated in terms of your increased risk. Okay? Nowhere under any age group, all ages being unvaccinated, among people 18 to 49 being unvaccinated, from people to 50 to 64 being unvaccinated, being older than 64. Nothing comes even close to being unvaccinated in terms of its risk. Even having 10 medical conditions, being severely obese, being an organ transplant recipient, having multiples of these things, being severely obese, being black, being male, being a recent cancer, having recent cancer, being an organ transplant recipient, and maybe having 10 medical conditions, maybe you'd start to get close to being unvaccinated. All of those together. You have everything that's bad, you're getting close to being just merely being unvaccinated. Okay? It's not in the same ballpark. And this is the reference that I used to generate that graph. You can see it if I hovered over it. If you want to replicate it, pause it, and put that into the bar and make sure that I'm getting this right, and I am. Nobody's questioned these among the thousands of people who have seen this thread, the hundreds of thousands of people who have seen this thread. Nobody's questioned this because I was very careful here. So you can look at this and replicate it and make sure that I'm right. I am right. The striking effect of vaccination on death rates is also quite visible when looking at the original CDC data from which this graph was derived. And here we can see not fully vaccinated is that black, fully vaccinated is the blue. It's just night and day difference in terms of the death rate. Night and day difference. Okay. For completeness, let us compare all of these to age. We can see that not only does age dominate, but age dominates overwhelmingly, and age dominates even being vaccinated or unvaccinated. So really, two factors are the most important. Age for COVID death. If you're older than age 85 compared to being young, I think in this case it's under 30, if I recall correctly with these data, you have a 570-fold increased risk of dying from COVID by being over the age of 85 compared to under 30. So age is just overwhelming. Age is overwhelming. It even overwhelms being unvaccinated. Okay? Dramatically, it overwhelms being unvaccinated. Age. And then being unvaccinated trumps everything else. So the first variable that's most important is this basically a pandemic of the aged, the elderly. Okay? That's the objective fact. So you're not going to hear that anywhere because it doesn't fit anybody's narrative, but that's the truth. You're going to hear it some places, but it doesn't fit in with a good narrative most of the time. Second thing is being vaccinated or unvaccinated. Third thing is like being black or having medical conditions. And then the last thing, the most unimportant thing, is having mild obesity, moderate obesity, and severe obesity may be slightly worse than being black or being male. Yes, these conditions, having obesity is worse. It's bad. It's not good. But it comes nowhere close. Comes nowhere close to any of these other factors. Not vaccination and definitely not age. Definitely not vaccination, like by orders of magnitude, and not age by even more orders of magnitude. Okay, that is the fact. Okay, COVID deaths are driven by age first, unvaccinated status second, the presence of serious medical conditions third, and then by an equal mix of obesity and other risk factors by like being black, being underweight, being male, etc. That is the fact. That is the fact. Check this graph out. This is the truth. The risk of death from COVID is due to obesity is comparable to being black or male. This risk is far outstripped by serious medical conditions. All of this is far outstripped by vaccination status, and age far outstrips vaccination status as a risk factor for death from COVID. These are the facts. You can ignore them if you want, but you're living in a dream world if you ignore them. You're saying things that are not true if you ignore them, okay? Obesity is not driving this epidemic. obesity is only driving this pandemic if you ignore the data. We'll see even more of this in a moment when it's time to shred the misinterpretations propagated by mainstream media. In any case, the prevalence of the dichotomy between obesity and vaccination, i.e., you don't need a vaccine if you're fit or lean, in the discussion about COVID is rapidly growing, or it was at least a year ago, despite having no factual basis. This is a serious problem. To show this, I've plotted the frequency of tweets per day mentioning vaccine and obesity in the same tweet over the course of 2021. As we can see, this discourse grew and grew and grew. Vaccine and obesity, these two words are constantly coupled with each other because this discourse about the dichotomy between vaccines and obesity became increasingly prevalent over time. As can be seen, there's a small explosion in discussion mentioning both vaccines and obesity in early March, which petered off during the summer when COVID cases petered off. Okay, the discussion came roaring back when COVID returned a few months ago, and this was in September of last year, and is now exploding bigger than ever as anti-vax attitudes have mainstreamed. Okay, but why did the initial explosion in this discussion occur in March? There are two events that caused this, and the mainstream media is responsible for both. These events were, one, the release of an extremely bad pseudoscientific report by the World Obesity Federation and the uncritical press coverage that followed. Two, the press coverage that badly misinterpreted a CDC report on the relationship between COVID and obesity. Make no mistake, the mainstream media is 100% responsible for this false narrative that has exploded in anti-vax circles and threatened and did undermine public health. I will now demonstrate this. On March 4th, a report that tortured and abused the international data on overweight and COVID-19 mortality to advocate for even more intervention and treatment for obesity was released by the World Obesity Federation. This report was widely covered by the media. Financial Times reported on it, CNN reported on it, Reuters reported on it, BMJ reported on it, Washington Post reported on it, Royal College of Physicians reported on it, The Guardian reported on it, Bloomberg reported on it, Medscape reported on it, Al Jazeera reported on it, The Independent reported on it, Sky News reported on it, The Hill reported on it, Seattle Times reported on it, NPR reported on it, Forbes reported on it. BBC reported on it, New York Post reported on it, Fox reported on it, and others. The report by World Obesity Federation claimed that there was a 10-fold higher rate of death due to COVID-19 in countries whose populations had more than 50% overweight. The claim of a 10-fold higher mortality rate was uncritically accepted by all mainstream media outlets that reported on it. The World Obesity Federation made use of an in-house proprietary analysis of the international nation-level obesity and COVID mortality data. This analysis was not peer-reviewed, nor again was it critically evaluated in a single mainstream media outlet, despite being wildly at odds with every known estimate about risk of death due to COVID. This analysis used extremely primitive epidemiological tools and p-hacked the data to generate estimates of mortality rates due to overweight. A full discussion of the problems with this report is too lengthy to go through here. We have a lot more to talk about in this thread, but to read my analysis of the study, see the following. So there's you can find it in September 6th. The tweet starts, in March this year, this piece of pseudoscience was released to the public, to much fanfare. News media organizations across the world reported on it in detail, belying the common claim that the media does not care about obesity. Okay, so if you do search for those terms, you can find it in my Twitter account. But let's go on. Well, we can point out a few things briefly related to this. First, any well-trained epidemiologist would know that this study was misleading and wrong. Why wasn't one consulted? Second, if one was consulted, why was the report published? One can only guess that the World Obesity Federation was engaged in ends-means reasoning. The obesity pandemic is a serious health problem. It demands our attention. Advocacy for this problem can only help improve health, even if our analyses are not quite right. Right? Well, this is obviously wrong, as the World Obesity Federation report is now fueling anti-vax sentiment. Let's recall the tweets at the beginning of this thread by Marjorie Taylor Greene and Donald Trump Jr. Health organizations need to report the truth, not exaggerations of the truth to trick people into doing the right thing. Okay, this is a common thing on my podcast, on all my health science communication. We need to report the truth, not exaggerations of the truth, to trick people into doing what we think is the right thing. Let's look again at the graph on frequency of tweets discussing both obesity and vaccine. See that spike at the beginning of March? Yeah, that big spike, that's from the World Obesity Federation report. Now let's check out another graph. This one discussing COVID and obesity without replies. The same spike at the beginning of March from the World Obesity Federation report. But what is interesting is when you line these two graphs up together side by side, this is because the same discussions about obesity and COVID are feeding into discussions about obesity and the vaccine. Wildly exaggerations about obesity and COVID are fueling anti-vax. Okay? But if you look at obesity and COVID graph, there is another spike beginning in March. That was March 8th, another media event. On March 8th, a major story ran across most major news outlets. 78% of people hospitalized for COVID are overweight or obese. CNBC ran it, Forbes ran it, Newsmax ran it, Axios ran it, Business Insider ran it, Yahoo News ran it, Times of India ran it, NBC Boston ran it, Fox News ran it, ABC ran it, and Becker's HR ran it. And this is that statistic that Bill Maher shared with millions of viewers on YouTube and HBO. All of these media organizations ran it, driven by desire for clicks, advertising revenue, and prejudice against obese people. The story was uncritically run by dozens, if not hundreds, of news organizations. And it is incredibly misleading and massively overstates the obesity-COVID connection. What's wrong with it? This. People say 80% of deaths, complications, etc. are in people with obesity, but actually the stat is this: 78% of Americans hospitalized for COVID are obese or overweight. Here's the other important stat though. 74% of American adults are overweight or obese. So 78% of people with COVID are overweight or obese. 74% of Americans are overweight or obese. Are you starting to see the problem? 78% versus 74%. It's essentially representative of the American population. 74% of people are overweight or obese. 78% of people are hospitalized for COVID or overweight or obese. Of course, why wouldn't you expect about 74%, 78% of people to be hospitalized for COVID to be overweight or obese? That's that's what the normal population is. In other words, overweight and obesity isn't dramatically overrepresented in the people who are hospitalized for overweight and obesity. Rather, 74% of Americans are overweight or obese in the first place. That's why 78% of people who are hospitalized for COVID have overweight or obesity, because it represents the population. That's what the population is. One person translates, I'm pointing out, he says, he's pointing out that the percentage of obese people in the hospital with serious COVID roughly matches the percentage of obese people in the United States. Therefore, you can't point to the percent of obese people and say it was caused by obesity, because the sick folks simply mirror the available population. Beautiful. Now, if you don't understand that point, pause it and read that again. Let's continue. And here's some more analysis. Obesity figures from the CDC and COVID deaths by BMI category from Statista. 42.4% of Americans are obese. 46% of COVID deaths are in obese adults. It's almost the same. 9.2% of adults are severely obese. 12.6% of COVID deaths are in severely obese adults. It's almost the same. And if you read the original CDC report, it does not make the misleading linkages that the media decided to make. This is entirely on the media. Contrary to what Bill Maher and countless health influencers have claimed, the obesity COVID narrative has in fact been driven by the mainstream media, not by counter media narratives. The anti-vax fallout has resulted, therefore, has also been caused by the mainstream media. If the actual truth was reported by the media, the anti-vax narrative would be impossible. But if people believe that obesity is this massive, overwhelming risk factor, yeah, then anti-vax can weaponize it and tell people that COVID is an obesity disease, as has occurred. Here's more. Here's just more people saying the same stuff. Looks like we need a BMI passport more than a vaccine passport. Nobody tells you that the ICUs were regularly at or above capacity even before COVID. Obesity has been an issue before 2020, which is kind of true, at least. Obesity is a bigger pandemic than COVID, right? People say this stuff. And now, what we saw at the beginning of the thread, a Great Barrington Declaration signee jumping on the same narrative. Obesity is a serious public health problem. I got into nutrition and obesity because I want to end the obesity pandemic, which would massively improve the quality of life of so many people and prevent so many deaths. But we need to be honest about the data and the facts if we are going to have the most effective policies. Dishonesty about obesity has been driving widespread anti-vax narratives. The COVID obesity exaggeration is a case study in the importance of being honest about the facts. Okay? Not using ends means reasoning, not overplaying obesity because we think it should be addressed, which it should be. But these lies about obesity and COVID drive anti-vax. It's a cautionary tale about not lying about the facts. Mainstream media organizations should all apologize. They should retract their horrible stories and write new stories to accurately convey the actual scientific association between COVID and obesity. If they did that, they would be combating anti-vax and contributing to public health and not profiting at its expense. Please share this video or others like it if you see people spreading COVID obesity misinformation, which is widespread. And I want to point out, I sent this thread to a well-known journalist who responded that the Obesity-COVID Association is well established by a large body of legitimate scientific research. The journalist also pointed out that it did not address the CDC's position. To this, I wrote the following reply, and I just want to be very clear. I said, thank you for your challenging comments. From the hip, this is what I would say. The Obesity-COVID Association is real and almost certainly causal, and it is right to treat it as real and causal. It's a real association, and it's really the case that obesity makes COVID worse. I fully acknowledge that. It's totally important, and it's important. I don't think that there's anyone who disputes that, nor do I. I don't dispute that. The COVID Obesity Association, however, is overstated by the media, and the statistics on the association were abused by the WPO, the World Obesity Federation, as well as by the news coverage of the CDC data, with the outcome of overstating the association. This overstatement is what I refer to as the obesity COVID narrative. By obesity COVID narrative, I'm not referring to the fact of the causal relationship between obesity and poor COVID-19 outcomes. This is well established. Again, by obesity COVID narrative, I refer to the popular interpretation and exaggeration of this fact, as well as the articulation of this interpretation and exaggeration with anti-vax and other critical or anti-establishment narratives. Case studies of the COVID obesity narrative include the discussion that ensued around the 78% figure misrepresented by the news media and the misrepresentations and conclusions by the WPO, which are, unlike the 78% figure, untethered from factual reality. Arguably, other such case studies might include, in the mainstream media, no less, Bill Maher blaming poor COVID outcomes on Little Debbie, or Joe Rogan implying that if one is in good health, i.e. not obese, then vaccination should not be recommended. I've discussed the CDC data in several places I have not discussed the role the CDC played in the propagation of this misinformation. I will note that the CDC, as far as I can tell, and from a completely unsystematic sampling perspective, seems to have especially pushed obesity as a risk factor for COVID. Although I do not question the integrity of the CDC's analyses, the risk ratios due to various classes of obesity are broadly consistent with the risk ratios of every other piece of research I've read on the subject. I will question the way that these analyses have been communicated in press releases. I contend that the way that these analyses have been communicated in press releases have contributed to the obesity COVID narrative, as they call it. Specifically, although it makes sense to emphasize obesity since it is one of the most widely prevalent risk factors for poor COVID outcomes, the relative risk of obesity versus other important risk factors is rarely discussed. And the constant drumbeat of obesity COVID, when not placed into this context, can and has been widely misinterpreted to suggest that the COVID pandemic has been driven by obesity. If I were to give an honest estimate of the number of deaths from COVID attributable to obesity in an unadjusted manner, i.e. including the average burden of obesity-related disease in America, I would give something along the lines of 10 to 20% of COVID deaths. While this figure is substantial and deserves an important place in the discussion, and I fully intend on giving a science-based estimate of the figure in future posts, it falls short of the impression given by the 78% figure, much less the WPO report, much less the undue emphasis placed on obesity and lifestyle as part of a right-wing participation in the obesity COVID narrative. See Trump, Jr., and Rogan. We must question what the goal is in emphasizing obesity as a risk factor for COVID by the CDC. Given the poor understanding of how obesity policy should function to produce substantial reversals in the obesity pandemic, i.e. it needs to produce material changes in the food environment via political, cultural systems level change, and the relative bias among the public toward fat phobia and victim blaming, it seems inevitable that the American political and cultural context that emphasizing obesity would lead to victim blaming, diet book hawking, etc., rather than a sober discussion about how you might need to realistically think about what measures must be taken to reduce obesity in America. There is no question that obesity is a source of disease and death in America, and that we need to reverse the obesity pandemic. But in hindsight, it seems like a terrible mistake for the CDC to have constantly emphasized obesity without explaining to the public how this needed to be understood, nor without placing obesity in the context of risk factors to appropriately explain the magnitude of the problem without exaggerating or minimizing the problem. In this respect, my criticism is much like my criticism of the use of relative risk over absolute risk in studies communicated, for example, about red meat and colon cancer. My criticism is not on the scientific basis of the COVID obesity association, but rather about the way it is being communicated. I'm not criticizing science or scientists apart from the folks at the WPO. I am criticizing their poor science communication, and I am proposing that steps be taken to provide appropriate nuance to the now widely propagated causal association between obesity and poor health outcomes. Science is science and needs to be done without regard to cultural, political, public health, etc. implications. However, science communication, which involves translating those findings into recommendations and statements for public consumption, needs to consider practical consequences of statements about science and needs to have a more active educating role. It is in this respect that CDC and to some extent even many medical experts have failed and have even unwittingly fueled an uncritical, clickbait-driven media machine, in turn fueling anti-vaxxers and medical contrarians, ultimately harming public health. Thank you for your criticisms. They have provided food for thought and helped me to further develop my understanding. Now with that, I hope you guys enjoyed this video. I need to put it together into an article. I haven't gotten a chance to yet. Once I do, I will make another post about it. But in the meantime, if you liked this video, make a nice comment. I would much appreciate it. And sign up for my Patreon. Support me, because that would be great. Those are the two nice things you could do. Or you could share it. And please, once again, share it with Joe Rogan. Make sure he knows this perspective. It's really important. Thanks for watching. I hope you enjoyed the podcast. Please check me out on patreon.com at Kevin and Bass, where you can donate and make this podcast possible. Also check me out on Twitter, Instagram, TikTok where you can find my latest thoughts on the latest controversies and findings within health science. Also check me out at The Kevin Bass Show, both on Spotify, Apple Podcasts, and YouTube. I hope this podcast was useful to you. If it was, please leave me a 5-star review on Spotify or Apple Podcasts. See you guys in the next episode.